welcome to the Diabetic Diary, or Taming Diabetes, wherever you're watching it. I'm Ollie. Today I just wanted to do a quick video on diabetes and mental health, and in particular bipolar. I was doing some research yesterday for an article on this subject, and I came across this article I printed out online, which says that diabetes is found in people with bipolar disorder nearly 3 times more than in the general population. This has prompted much research into the link between diabetes and bipolar disorder. Studies have found that people with bipolar disorder tend to be overweight or obese, a key risk factor in developing diabetes. Research into potential causes of this weight gain has identified medications used to treat bipolar disorder as the likely culprits. Now that's a shock to me because I'm bipolar. I'm 41 now, and I was diagnosed when I started having symptoms, I should say, when I was about 20. I was in the army, and the army being the army, I wasn't diagnosed until I was medically discharged with it at about the age of 30ish. I don't remember the exact date. But I had it, and I probably had it way before I was 20. I just didn't know. Although looking back, I can see these signs. So this has come as a shock to me because all the medication I've been taking, and I've been blaming myself fully for my diabetes. Now I'm not trying to shy away from anything here. I have drank a lot of alcohol and I have eaten a lot of food I shouldn't. But then I think to myself, well, has that been to do with bipolar and things like that? Now, on top of bipolar, I also have what's known as borderline personality disorder, or I have traits of it, or full-blown borderline personality disorder, I'm not sure. And I have PTSD, and I have general anxiety disorder. But there's all these things going on, and I'm getting treatment for them all. I just tend to bundle them into one and treat the symptoms. So I don't know what's bipolar, what's borderline. I just treat the whole thing as a bundle, and I find it easier that way. So with all these illnesses going on, and after reading this, I'm thinking, well, was the reason I started because I did just suddenly go from being really fit to eating loads of rubbish about the time that I was diagnosed and started being treated all those years ago. So it's given me food for thought, and you know, I'm thinking to myself, well, I've been blaming myself fully for the diabetes, but is the blame all me personally and my choices, or is it something to do with these facts I've just recently discovered? Well, who knows, but mental illness obviously doesn't help diabetes, and obviously it can you know, add to the cause of diabetes, because I myself I used to turn to alcohol and things like that when I got down periods in my life, and that changed. I went through all the things like gambling, all that sort of thing, and then after I'd stopped doing those sort of things, I got into food, and that's when I started piling on the weight. But you know, after reading this, I wonder whether it has had something to do with my medication, because I've always thought that I put on weight. And my wife laughed earlier when I said this, because she said, "Ollie, how can you blame your medication? You used to stuff your face with food." And yeah, I did, but you know, I'm not trying to make excuses here, like it sounds like it, but I did think I put on a bit more weight than I should have for what I ate, because I was quite active. I had an active job, things like that. So who knows? But I just thought I'd do this quick video. If you have any thoughts on it, leave a comment below, and I'll see you again soon. Thank you, bye.